Assalamu alaikum. Today I'll be discussing the origin and insertion of the various suprahyoid muscles. So you have four suprahyoid muscles. In fact, you have five suprahyoid muscles. Naming them, you have the digastric. This is the digastric muscle. It is the anterior belly of the digastric. Sorry, this is the digastric muscle. This is the anterior belly of the digastric muscle, and this is the posterior belly of the digastric muscle. Anterior belly of the digastric muscle and the posterior belly of the digastric muscle. Anterior belly ये है और posterior belly ये है. This is the intervening tendon. So you have two digastric muscles on two sides, and each digastric muscle has two bellies, anterior and the posterior. In between they have a tendon. If we talk about the origin of the anterior belly of digastric muscle, that arises from the digastric, ये आपकी mandible है. It arises from the, you have a fossa on the middle of the mandible, that is called as the digastric fossa. The anterior belly arises from the digastric fossa. Posteriorly here you have a mastoid process, वो beaked process होती है यहाँ पे पीछे से, कान के पीछे से, you can feel it. You have a mastoid process in which you have a mastoid notch. There. The posterior belly arises from the mastoid notch. Then they meet, and both these meet at the tendon. Fine, they meet at the tendon, and then they both since they both meet at the intermediate tendon, this is the point where they get inserted. They both meet at the intermediate tendon. Fine, जब ये दोनों मिलते हैं intermediate tendon पे, this is your stylohyoid. This is your stylohyoid muscle. This muscle is your stylohyoid muscle. And they perforate this stylohyoid muscle. Fine. So your source of origin for the anterior belly will be from the digastric fossa, and the posterior belly will be from the mastoid notch. They will both meet at the tendon. Which perforates the stylohyoid muscle. Then anterior belly will be supplied by the nerve to mylohyoid. ये है ना digastric के नीचे यहाँ पे mylohyoid muscle. So anterior belly will be supplied by the nerve to the mylohyoid, and the posterior belly is being supplied by the facial nerve. What does it do? It depresses the mandible and elevates the hyoid bone. Then comes your another muscle, that is the stylohyoid muscle. This is your stylohyoid muscle. This is your stylohyoid muscle. Can you see the muscle over your posterior belly of digastric? This is your stylohyoid muscle. It arises, यहाँ पे एक तोंत जैसी प्रोसेस होती है. This is called as a styloid process. छोटी सी एक प्रोसेस होती है, वहाँ से arise होता है. Since its name is also derived from that only. Styloid process से start हो गया तो हो गया stylo, and it ends up on the hyoid. In fact, at the junction of body and greater cornu of hyoid. वो आप osteology में पढ़ोगे hyoid bone. It ends up at the junction of the body and the greater cornu of the hyoid. So it arises from the styloid process and ends up at the, ये आपकी है hyoid bone. ये this is your hyoid bone. ये इसका greater cornu है तोंद जैसी, and this is the lesser cornu. It ends up at the, ये इसकी body है, junction of the body with the greater cornu. It is being supplied by the facial nerve. It elevates the hyoid bone. Fine, its function is the elevation of the hyoid bone. Then comes your mylohyoid muscle. The muscle beneath your digastric is your mylohyoid muscle, forming the floor of the mouth. This mylohyoid muscle arises from the mylohyoid line. Mandible आपने पढ़ी है. So mandible के अंदर से you have a line that is called as the mylohyoid line. This mylohyoid muscle arises from the mylohyoid line. Then it gets inserted on the body of the hyoid, and moreover it gets inserted on this median raphe. ये है बीच में एक median raphe जैसा होता है. इस पे insert होता है और it gets inserted on the body of the hyoid. It has its origin from the myeloid line which is present on the mandible, and it has its insertion on the hyoid bone and the median raphe. This mylohyoid is being supplied by the nerve to mylohyoid. After that, what are its functions? It elevates the floor of the mouth and it helps in the depression of the mandible. Then comes your geniohyoid. Your geniohyoid muscle, it arises here. Fine. It arises here. Your mandible has got tubercles, superior genial tubercles and inferior. It arises from the inferior genial tubercles. Fine. Geniohyoid. It arises from the genial tubercles from the mandible and gets inserted on the body of the hyoid bone. It gets inserted on the body of the hyoid bone. It is innervated through hypoglossal nerve. It has been innervated via hypoglossal nerve. Its function is the elevation of the hyoid and it depresses the mandible. Its function is the elevation of the hyoid bone and depression of the mandible. After that comes your last muscle, that is the hyoglossus. I will show you. 1 minute. After that comes your muscle, that is the hyoglossus. I will see where it is quite clear. I will show you that picture only. Okay, this is your hyoglossus muscle. This is your mylohyoid, the muscle above it. I think I have a better picture. Wait. See, this muscle is your hyoglossus muscle. Before this muscle we were talking about the geniohyoid muscle. This is your geniohyoid muscle. Your geniohyoid muscle, as you can see, this is the mandible of the skull. So posteriorly it has superior genial tubercles and the inferior genial tubercles. It arises from the inferior genial tubercles and ends up in the body of the hyoid bone. Similarly, you have another muscle among the suprahyoid muscle, that is your hyoglossus. Its source of origin is from the hyoid bone, mostly the greater cornu of the hyoid bone, and it gets inserted on the side of the tongue. Being supplied by the hypoglossal nerve, it depresses the tongue. Its function is the depression of the tongue. Then comes your submandibular gland. Parotid, you have three main glands. You have parotid gland, you have submandibular gland, and you have the sublingual gland. Talking about the submandibular gland, this is your submandibular gland. It is just of the size of a walnut. It is present in the anterior part of the digastric triangle. Fine. Can you see? It is J-shaped, and I think this pic will be quite clear. This is J-shaped. Your submandibular gland is a J-shaped, being intended by the posterior border of the mylohyoid muscle. It is J-shaped, and it is being divided by the mylohyoid muscle into two parts. This part is the superficial part, and this is the deep part. It has a superficial part that is superficial to the muscle, and deep part that is deep to the muscle. After that, 1 minute. So this is your submandibular gland. Then this submandibular gland has certain parts. This submandibular gland has certain parts. As you can see in this picture, this is the superficial part of the submandibular gland, and deep to the mylohyoid, this muscle, this is the mylohyoid. Deep to the mylohyoid muscle, you have the deep part. It has three surfaces. The superficial part has three surfaces: inferior, lateral, and medial. Inferior, lateral, and medial. And this gland is being partially covered by the deep cervical fascia. It is being partially covered by the deep cervical fascia. If we talk about the relations now, see the inferior surface. अगर हम inferiorly देखेंगे, what will you come across? First of all, you will have to lift the skin. After lifting the skin, you have a thin membrane type muscle here, that is called as the platysma. Then you have to remove the platysma. Then you have a facial nerve here, इसका cervical branch. Then comes your deep fascia. Beneath your facial nerve, you have your deep fascia. Then this is your facial vein, and you have the submandibular lymph nodes. These things come in the inferior relation of the inferior surface. I will again enumerate. First of all, you will elevate the skin of the area. Then after the skin, you will see there is a muscle called as the platysma. Removing it, you will see the cervical branch of the facial vein nerve. Then you have to remove the deep fascia. Then comes your facial vein, and finally the submandibular lymph nodes. This was about your inferior surface relations. Here you can see in the picture clearly. See, this is your submandibular gland. Is it J-shaped? Yes, it is J-shaped. And this is your submandibular duct, and this is your sublingual gland. Then it has a lateral surface. We are seeing the inner side of the mandible, half of the mandible. It has a lateral surface. Is lateral surface की relations क्या है? You can see submandibular fossa here on the mandible. So submandibular fossa is meant for the lodgement of the submandibular gland. So you will be having the submandibular fossa laterally. Then you will be having, see this muscle, this is the insertion of the medial pterygoid, and you have the facial artery. You have three things in the relation of the lateral surface. You have the submandibular fossa here, you have the medial pterygoid insertion, and the facial artery. Relations of the medial part. Then comes your relation of the medial part. In the medial part, from before backwards, you have mylohyoid. See, this muscle is your mylohyoid muscle from before backwards. This is your mylohyoid muscle. Then you have your hyoglossus, this hyoglossus, and you have your styloglossus, and you have the styloglossus. From this styloglossus, you have the mylohyoid, hyoglossus, and the styloglossus muscle. Three muscles which come in the relation of the medial surface. Then comes it overlies on the posterior belly of the digastric. It overlies on the, यहाँ पे आपको होती है posterior belly of the digastric muscle, उसके ऊपर होता है. It overlies the posterior belly of the digastric muscle. See the relations here. These are the lateral and the inferior relations. These are much more clear. If we talk about the inferior, this is your submandibular gland. If we talk about the inferior relations, this is your cervical branch of the facial nerve. Fine. This is your facial vein. Fine. This is your facial artery, submandibular lymph nodes. Fine. Then you have your lateral relations by insertion of the your medial pterygoid muscle. Fine. This is the diagrammatic representation of the relations of the submandibular gland. Then as you can see, J-shaped submandibular gland here. We have already discussed the superficial part. Then comes your deep part. You can see the division in the superficial and the deep part is by means of this mylohyoid muscle, which just intends into the your submandibular gland, dividing it into two parts, the superficial and the deep part. If we talk about the deep part, it is quite small in size, and this is your mylohyoid muscle. It lies deep to the mylohyoid muscle. And superficial, this is your hyoglossus, posterior to it, and it lies superficial to the hyoglossus muscle. Posteriorly, it is continuous with the superficial part of the submandibular gland, and anteriorly it extends into the your submandibular duct. It extends into the submandibular duct and ends up in the sublingual gland If we talk about the relations, laterally it has mylohyoid muscle, and medially it has hyoglossus muscle. Above it has lingual nerve, and below it has hypoglossal nerve. Laterally it has your mylohyoid muscle, and medially it has hyoglossus muscle. Above it has lingual nerve with submandibular ganglion, and below it has hypoglossal nerve. Then talking about the submandibular duct or the Wharton's duct. It is 5 centimeters in length. This is the submandibular duct. It is 5 centimeters in length, and it lies between the lingual nerve and the hypoglossal nerve. At the anterior border, this duct is being crossed by the lingual nerve. At the anterior border, this duct is being crossed by the lingual nerve. See in the picture, it opens on the floor of the mouth on the summit of the sublingual papilla. This is called as the frenulum of the tongue. Frenulum of the tongue के पीछे होता है sublingual papilla. उसके summit पे ये open up हो जाता है your submandibular duct here. ठीक है, it opens up at the summit of the sublingual papilla, just posterior to the frenulum of the tongue. So this was about the Wharton's duct or the submandibular duct. After that comes your see again here, this is your submandibular duct present between the lingual nerve and the hypoglossal nerve. Lingual nerve is winding around the submandibular duct, and it ends up in the sublingual papilla. Then comes your blood supply. Then comes your blood supply. It is being supplied by the facial artery. ठीक है, it is being supplied by the facial artery. Your submandibular gland, it is being supplied by the facial artery, which is a branch of the external carotid given at the greater cornu of the hyoid bone. What does this facial artery do? It just makes a S-shaped bend winding over the submandibular gland and supplies it. The venous drainage is by means of the facial vein, and lymphatic drainage is by means of the submandibular lymph nodes. Then nerve supply comes from the submandibular ganglion. The secretomotor fibers to the gland come from the superior salivary nucleus, which get transmitted via the nervous intermediates, then the facial nerve, then its branch, the chorda tympani. The chorda tympani, as I have shown you before, it joins the lingual nerve, making an acute angle, enters the submandibular ganglion and relays here, यहाँ पे रुक जाता है. फिर the postganglionic fibers arise and supply the submandibular and the sublingual gland. Then comes these are the submandibular lymph nodes draining the area. Then comes your sublingual gland. It is the smallest of the three glands, almond shaped. ये है आपका sublingual gland. It is almond shaped, 4 grams in weight. above the mylohyoid, lies above the mylohyoid in the medial to the sublingual fossa. It is medial to the sublingual fossa. From on the front, it meets the gland of the opposite side, sublingual gland of the opposite side. Posteriorly, it is attached to the deep part of the submandibular gland. Above, it has the mucous membrane of the mouth. Below, it has the mylohyoid muscle. Laterally, it has the sublingual fossa on the mandible, and medially, it has a tongue whose main bulk is the genioglossus muscle. If you can see, small ducts, 15 ducts emerge from the gland, and they directly open into the floor of the mouth on the summit of sublingual fold. They open into the floor of mouth on the summit of sublingual fold. It receives its blood supply from this is your sublingual gland. It gets its blood supply from the facial artery. This is the submandibular duct. This is the sublingual gland. These are the various small ducts arising from the sublingual gland, and they open up on the in the floor of the mouth on the summit of the sublingual fold. It is being supplied by the facial artery. This is your facial artery here. It is being supplied by the facial artery, giving the branches as the lingual and the submental branches. Moreover, the nerve supply is similar to the submandibular gland via the submandibular ganglion. Then comes your submandibular ganglion. This is the submandibular ganglion, which hangs by the lingual nerve. So it is just indirect, it is attached to the lingual nerve. In this picture you can see the demonstration of the connections of the submandibular ganglion. It is a parasympathetic ganglion, and it is a relay station for the secretomotor fibers of your submandibular gland and the sublingual gland. Fine. This submandibular ganglion, it lies on the hyoglossus muscle, triangular hyoglossus muscle. Then the connection, the secretomotor fibers, as you can see in the picture, they come from the lingual nerve. The secretomotor fibers come from the lingual nerve. These are parasympathetic preganglionic fibers. They arise from the superior salivatory nucleus. Then they pass through the facial nerve, its chorda tympani branch, and reach the ganglion. To relay. They will relay here. Then the postganglionic fibers which arise will go to the submandibular ganglion and the sublingual ganglion. Then sympathetic supply. This was the parasympathetic connection. Sympathetic comes from the plexus around the facial artery. It contains postganglionic fibers arising from the superior cervical ganglion. These doesn't relay in the ganglion. They supply the vasomotor to the submandibular and the sublingual glands. Sensory fibers reach the ganglion via the lingual nerve. Then in the applied aspect, you have two nerves on the sides of the spine of the sphenoid. One is auriculotemporal and other is chorda tympani. Injury to the spine of the sphenoid can lead to the injury of both the nerves, that is your auriculotemporal and the chorda tympani. This comes in the applied aspect. Then your submandibular lymph nodes need to be removed if there is carcinoma of the tongue, and this submandibular duct or the gland, it gets easily impacted by the stones. Can you tell me why? Because the secretions which come from your submandibular gland, they are more viscous, so there is a chance that stasis can occur there, and it leads to the formation of stones. Then your submandibular gland, how can you palpate your submandibular gland? One finger in the mouth and one finger on the cheek. You can feel for the gland and various stones or any malformation in the gland and whatever you can see. Then if you have to excise your submandibular gland for any pathology, like you say there is a tumor or so, what do you have to do? You have to just incise it below the angle of the jaw, since there is a branch of the facial nerve, that is the marginal mandibular nerve. You have a tendency to injure that nerve. So what do? You just give an incision below the angle of the jaw. I think this much is enough for you. Thank you.